Hi, good morning, guys, and welcome to Unique and Different with me, Shamla. And today I have a neurologist, Dr. Nicholas Maraj, who specializes in epilepsy and stroke. But today he's going to talk about meningitis because for the past couple of years doing this program, many of my guests who became guests, the cause was meningitis. And this month we celebrate, well, not celebrate, but we make aware in terms of sign language and deaf and hard of hearing. So, good morning, Nicholas. Dr. Nicholas, how are you doing?
I'm fine this morning. Thank you very much, Shamla.
Awesome. So, let's get straight into it. What causes meningitis?
So what causes meningitis? The easiest way to answer that question is to first talk about what is meningitis. So the meninges is the covering of the brain. If you think about it, there's the hair on the top of your head, then there's the skin, then there's the skull surface, which is the bony covering of the brain and the meninges. And between the skull and the brain itself is the meninges. It's essentially three layers. For the purpose of this discussion, we can just consider it one. And meningitis is meninges and itis. Itis means inflammation. So it's inflammation of the meninges or inflammation of the covering of the brain. And essentially, many things can cause meningitis or inflammation of the covering of the brain. The most common thing for our purpose of discussion is infections, so like certain bugs.
Right. And what causes meningitis?
So certain bugs cause it, and it depends mostly on the immune status of the individual. So for adults and kids, it's mostly bacteria. The most common bacteria is something called Streptococcus pneumonia, something called Neisseria meningitidis, and Haemophilus influenza. And as for both adults and kids who have normal immune systems,
Right.
but for people who have compromised immune systems, for example, people who have HIV/AIDS, sickle cell anemia because they lack their spleen, or who are significantly malnourished, they are at more risk of having meningitis, particularly because they can't mount a great response to these bugs.
What are some symptoms of meningitis?
So mostly the person would typically be normal before, and then they'd have a fairly sudden onset of fever, which is particularly high grade. You're talking about like 38, 39, 40 degrees Celsius, sometimes associated with chills, shaking at night. They typically have a headache, which is pretty severe encompassing the entire part of the skull, sometimes behind the eyes, sometimes more towards the back of the head. And what's a big one they have is a lot of neck stiffness. So they have a lot that's moving the neck back and forth. It's almost impossible to move the neck. And a big one that they typically tend to have is alteration in their mental state or changes in their level of consciousness from being normal to being confused, delirious, maybe even stuporous or being comatose even.
Wow, okay. And what are some precautions one can take to prevent meningitis?
Precautions for meningitis mostly involves taking front before front taking. So for all those of the three big ones that we just spoke about, is Streptococcus pneumonia, Haemophilus influenza, and Neisseria meningitidis, they're all very easily vaccinable organisms. When I say that, they have vaccines created that particularly that boost your immunity against these organisms. The Haemophilus influenza one is typically available to kids from when they turn 2, 4, and 6 months old. So most of the adults our age will have them. Streptococcus pneumonia and Neisseria meningitidis, they are also in the hospital systems. So vaccinations to those would significantly reduce your risk of having meningitis.
In terms of long-term consequence, what are some long-term consequences of meningitis?
So if meningitis, so meningitis can either be treated properly. So how you treat meningitis? Let's go into that first. So treat meningitis is mostly you need to figure out first and foremost that the person has what you consider meningitis. Somebody with those symptoms needs to be in hospital. They typically go to one of the tertiary centers, Mount Hope, Port of Spain, San Fernando, Grande, Point Fortin, Arima, or Tobago.
Right.
have a CT scan of the brain done to make sure there's nothing else wrong with the brain. Check to see if there's any inner infections as well. And then we do something called a spinal tap. A spinal tap is a very scary sounding procedure, but most of the people who've done it do it very, very, very often. Probably done about 5,000 since I came back home. Wow. There's fluid circulating around the brain, coming all the way down to the spine and then circulating back up to the brain. You numb the area at the bottom of the brain, at the bottom of the spine here. Take a small, put it in, access the fluid, and take that fluid and send it out for testing. To check what bugs grow in and if there's any other evidence of inflammation.
That's scary. Bugs.
Yeah. Bugs are the easiest thing. Right. You treat it with antibiotics after that, and provided you get hit it early and use the right combination of antibacterials and antimicrobials against it, most people have a fairly okay recovery. Some patients don't have the best of recoveries because of certain limitations. Long-term consequences, really big one, hearing difficulty, deafness.
Yeah.
It's a really, really big complication of meningitis. Most people who have meningitis should be sent for a formal hearing test about maybe a month to 3 months after they've had meningitis to assess what's their level of hearing. Seizures are also a big complication after meningitis, and sometimes they go on to become epileptic and need anti-seizure medication for the duration of their life.
Yeah.
And then some other people have lots of complications with thinking and thought and memory. And those are difficult to control and difficult to treat.
Well, so I guess my second to last question would be, is there a particular demographic that meningitis would attack? Because most of my past guests that I have had on contracted meningitis at the age of probably 6 years. So is there a specific group or anything, or is it just throughout?
So for that age group, that would still be the bacteria that we're talking about. Anybody who's not vaccinated against the causative bugs, not vaccinated Haemophilus, not vaccinated against Streptococcus, not vaccinated against Neisseria, have a higher risk of developing meningitis. Those without good immune systems, people who have sickle cell anemia, who have maybe HIV/AIDS, who malnourished, at risk, and certain things that disrupt the covering of the brain itself. For example, penetrating head trauma or neurosurgical procedures. Those people will be more at risk of having meningitis than the average person. So encourage everybody to get their vaccinations.
Your closing comment, would you like to say anything in general to the public about vaccination and meningitis? Anything you want?
Meningitis is a very scary disease. It typically affects kids more than adults, especially given their tender age, their tender immune systems. It's very, very scary for the parents who have to go through this type of trauma. What you need to know is that you need to know the signs of meningitis early: fever, headaches, alterations in their level of consciousness, awareness. If the child is not acting like normal, you need to take them to see a doctor immediately, and preferentially to a tertiary care facility. For example, Mount is the best bet.
Dr. Maraj, we are out of time, but I want to say thank you so much from Miss Maharaj. Dr. Maraj, thank you so much. I want to say thank you, and I would definitely have you on to talk about other neurological, other neurological, I guess, I can't find you, but neurological things, right? So, guys, with that being said, I want to say thank you so much for tuning in to this week's segment of Unique Not Different with me, Shamla. And as I always say, be good, do good. Bye. Bye, Dr. Maraj.
Have a good day, everybody.
You too.